I'm very excited today. It's the first episode of the MADtherapy Sessions, and the guest for today is Mansha Thakur. She's a national sprinter, a district level swimmer, a physiotherapist who's done her masters in sports and exercise therapy. She's also a mat Pilates trainer, an advocate of cognitive functional therapy, and someone whom I know since the day she came in this world. This is the full video podcast on YouTube. If you want to hear only the audio podcast, you'll have to head over to Spotify. The links will be given in the description below. Do check that out too. In today's podcast, we have Mansha Thakur. She's a physiotherapist by profession. She's an MSc in sports and exercise medicine, and she's a cookie monster. Mansha, welcome to the MADtherapy Sessions, and please take the mic and say something about yourself.
Okay, thank you for having me.
Yeah, welcome.
So I am a physiotherapist by profession. I've done my undergrad from DY Patil, Nerul.
Okay.
Then I worked for a year and a half, and then in Bombay.
Okay.
Then I went to the UK and did my masters in MSc Sports and Exercise Medicine, and I worked there for a bit.
Okay.
And then I came back home.
But you did MSc, right? Not
Yeah.
MPT.
Yeah.
MPT is something which I know.
Mm-hmm.
So, why did you choose MSc over MPT?
Okay, so I actually wanted to do a master's in sports.
Okay.
Because I have a very keen inclination towards sports since childhood.
Okay.
And then and I wanted a 1-year program only. I didn't want to put in 2 years.
Okay.
That's just how I wanted it.
Okay.
So I looked up. I started looking at courses and everything online. And I came across MSc in sports and exercise medicine. And that was the only course that had a 1-year course, basically. That was only 1-year course. MPT was all 2 years.
Okay.
So I looked it up and I saw the modules and everything, and it sounded and seemed really interesting and something that I would like.
Yeah.
So I just went with it.
So, but the MPT which you did, it's there only in Nottingham, or is there in other cities also?
No, MSc is there everywhere. It's there in a lot of other cities
Okay.
in the UK as well.
Okay.
But Nottingham was amongst the top ones for
Okay.
MSc in Sports and Exercise Medicine. I think after Loughborough.
After what?
Loughborough, that's another city.
Okay. Okay.
Loughborough University. So yeah, so
It's in UK itself?
yeah, it's in UK only.
Okay.
And it's supposed to be the top university for
Okay.
MSc in Sports and Exercise Medicine.
Okay.
But I had actually also applied there, but I didn't get in.
Okay.
So technically, I only applied for three universities, and I only got Nottingham.
Wow.
So
I mean, it's like taking a risk, right?
Yeah.
Because people apply in
Multiple.
more than dozen universities, because ek jagah nahi mila to you get in second one.
But I actually saw the modules and only applied in the
But
ones that
you were
I was
confident
interested.
about your thing because you were confident about your CV and that's why you just applied in 3 universities, or it was not the case?
It was not the case. I just saw the modules and only went for the universities I liked. I didn't go for the others because I rather do get in a university that I want to, right? Like, otherwise, what's the point?
Yeah.
So I just went for it. And so I got into Nottingham, and then later I actually realized that I had a friend who had already done the same course. So then
Like a senior?
No, he was my batch in
Okay.
DY. But then he
He did it earlier?
Yeah, he went earlier. So then I got a lot more information from him. So it was good. All in all, it was a good call.
So basically, his feedback also played an important role.
Yeah, definitely. He gave me a lot of positives. He told me his how he found it, positives and negatives.
Okay.
And so I heard him, and just went for it.
And how was your overall experience, in Nottingham, the MSc part? How was it overall?
It was really good actually, because I actually didn't go with any expectations.
Okay.
It's going to be like this or it's going to be like that. So because I just went with an open mind, and I absolutely loved it. All the modules, obviously there were 1 or 2 which were not great. According to me, could have been better.
Okay.
But all in all,
The teaching part, you mean? No.
Even the modules, even how
What
the
was
modules,
being taught?
Yeah, what was
Okay.
being taught as well. So all in all, it was amazing though.
Okay, so when you say that, what do you mean? It was too easy for you, or it was repetitive, or it could have been better? I mean, it was not a master's level kind of thing. I mean,
No. It was great. Only I thought maybe some modules like it could have been a little more practical.
Okay.
Practical.
It was more theory.
Yeah, not theory. It was more research based, which
Okay.
it is all the time. Abroad is more research, which is
Okay.
great. You learn a lot.
Okay.
But it could have been a little more practical. That's how I would like it.
So
But
whatever was being taught, that should have been implemented clinically, is what
yeah,
you
a
mean.
little bit. That's what I
Okay.
think. But again, I think MSc is such a course
Okay.
that I don't know how much practical you can put into it. Because it's more of like on-field work.
Okay.
Okay. So yeah, but
So,
yeah, go ahead.
like, so when you were doing MSc, were you attached with hospitals or sports associations or clubs? Because it's MSc in sports and access medicine, right?
Yeah.
So were you collaborating with other people during a course, or?
Actually, we did have some clinical postings as well in
Okay.
different hospitals in different cities close by.
In Nottingham or?
Close to Nottingham
Okay.
and in Nottingham.
Okay.
Besides that, we also had on-field postings.
Okay, that's great.
That was with through college itself, because
Okay.
university has a huge campus and they have a lot of sports going on. We have a whole sports setup, like how in DY Patil we have, same thing but twice, 3 times the size.
Yeah.
And so they have a lot of in-house matches. So because of that, we used to be like the on-field medical providers, basically.
Okay. So majorly it was football or?
No, rugby.
Rugby.
Yeah, rugby was very big. So
Okay.
rugby, football, these were more related to what we were posted in.
Okay.
But sometimes there were certain tournaments as well, so which had multiple sports. So it has basketball, it had tennis, it had like loads. So then there also we were given a chance and opportunity to go on field, So it was nice. All in all, it was great. And there's one thing I would like to talk about is there was this one more course that we had, a 2-day course.
Okay.
It was in Nottingham only.
Okay.
It was from the FA.
Okay.
So it was a 2-day very intense
The Football
course,
Federation.
The Football Federation. And it was a very intense course on
Was it the one in
trauma.
Wembley?
Sorry?
Was it the one in Wembley?
No, that was a seminar.
Okay.
That was a seminar. This was in Nottingham. This you can do otherwise also, but because we were in Nottingham, this is incorporated in our course.
Okay.
In our syllabus. So it was on advanced acute trauma that happens on field.
Yeah.
So it was that.
Okay.
So practical theory, there was lots going on.
Okay.
So it was one of the best parts about my course, I would say.
Okay. That's great. So like overall, like you enjoyed the experience, and how about the city? How about the people there? I mean, because it also plays an important part when you're like going out of India.
Yeah.
You can love the college, but you have to love the surroundings, the people, and I'm sure people from other countries also may be a part of your, your course.
So Nottingham basically comprises of the 2 main universities. One is the University of Nottingham, one is Trent University.
Okay.
So it's a very student-friendly city. Very, very student-friendly. So 80% are only students.
Okay.
Okay, unless like outskirts is more residential and all. But so it's very student-friendly. So and lots of Asians.
Lots of Asians.
Lots,
Okay.
yeah. So you never really felt like, out of place. And even like people from different countries, very, very friendly. So I didn't ever
I'm
feel
sure a lot of local people also must be
local
really
people
helpful, because
also.
education plays an important role in,
Yeah.
for them also financially.
Yeah. So it was great. It was, like when I finished my course, I was hoping that I get a job in Nottingham only.
Okay.
Because
you ended up loving the city.
Yeah, I loved the city. The university
Because when you talk about UK, people, I mean, the first city which comes to people's mind is like London
yeah.
or Manchester, but then
bigger ones.
Yeah.
Yeah, not everyone's familiar with Nottingham, but I absolutely loved it. Also, then it comes down to comfort, because I was there for a year during my university. Then, so obviously I was more comfortable with the city as well.
Okay, that's great.
So yeah.
But then, like, why did you choose MSc over MPT? Because for me, after physiotherapy, after BPT, so does MPT, like
Yeah.
what I have heard.
Yeah.
So how did you come to this conclusion, or even thought about doing MSc over MPT? Or, I mean, did you do your research, or it just like, I mean, you had
No.
reasons?
No, so there was no particular reason as such. As I said, I just like looked up the modules. But according to my knowledge, in MSc, it also has like medicine involved, a little bit of medicine involved, not only physio related.
Okay.
But
MSc has
has like medicine involved as well.
Okay.
So that's the only difference I would say. I don't think it really matters when probably you're going for a job or anything, unless it's very specialized.
Okay.
For example, like if I'm going now, if I'm into musculoskeletal, okay, now they are not going to see, oh, I have an MPT or I have a MSc. It doesn't matter.
Okay.
Because I'm going for a musculoskeletal, I have a BPT, right?
Yeah,
which is like the basic.
Yeah.
So it's not that one is going to choose, they are going to choose me over someone else or someone else over me because of the title of my master's, like MPT or MSc.
Okay.
I don't think there's too much of a difference when it comes to that.
But that's...
Unless it's MSc in sports and exercise medicine, MPT in neurophysio. That's too drastic, like two very different things.
Okay.
When it comes to musculoskeletal and sports, it doesn't really matter as such.
Okay. But then, like, that's your reason for doing MPT. MSc. But why not MPT? I mean, you must have gone through the whole curriculum of, or like, you know, and probably you may not have liked what you...
Yeah, because as I said, I wanted to do something in sports.
Okay.
And MSc had like on-field postings and on-field, basically just on-field, how you are supposed to be as a physio on-field. You know, now MPT again, there are many reasons actually, because MPT was more 2 years. So it was a lot of things. Like I was not, in my head, it was not like, oh, I want to do a MPT only or want to do a MSc only. I didn't really think about it that much, like the title of what it was going to be. But I just wanted to see what the contents are of the course, and do they interest me? Is that what I want to learn? Okay. So I just went with that.
But MPT also has something to do with sports, right? Because there's, there are masters in sports, right?
Yeah.
Which happens in, like, I think Punjab.
Yeah, but again, that's a 2-year course. That's the same. So I wanted a 1-year course only.
Yeah.
So,
but like any major reason for that? Like,
no, for me personally, it was not a major reason.
Like no personal reason to do a 1-year course and not do
like that.
Yeah.
Firstly, because I didn't want to do a master's.
Okay.
Because I was too tired of studying.
Okay. Because you're happy with what you were doing after doing BPT, right?
Yeah, I was okay. But then as they say that masters is very important because
so
of
I'm
how
sure like you must be having your reasons of doing masters. I mean, while after BPT when you're working, there might be reasons why you felt like, okay, I think I should do masters. Because can be many reasons, can be financial reasons, can be people not paying you that much as a BPT, people not one of the reasons, people not respecting you enough because you are just a BPT.
Yeah.
So like any such reasons, like, you know, did they play a important part in you deciding
to do a master's? Yeah. So I was not going to do a master's. I had made up my mind.
Okay.
But then after my physiotherapy, I started working in this one company.
Okay.
So it was a New York-based company.
That's great. Wow.
So
like in Mumbai?
In Mumbai. So it was the first branch in Bombay.
Okay.
And the owner was Miss Karina Wu. So she's in New York. So she's the owner of the New York clinic. So she actually got in partnership with another person from India, Kinjal. Kinjal Shah also used to work with her in New York. So both of them together partnered and opened a clinic in Bombay.
Wow, that's an amazing concept.
Yeah. So I started working with them. That was like my first job. And so it was actually Karina who kind of convinced me, and she said
masters.
Yes, she said it's very important. Like my mom was going on about it, but I didn't bother so much.
Okay.
But when she told me that, you know, it's really important to do a master's just for your growth, you know, professionally, and obviously salary does play a role when you have a master's here. When you have a master's here, your salary is always going to be higher than someone who's done a bachelor's, unless you start your own practice.
Okay.
You know, so because she said that. And then I thought about it, you know. So I said that's why the other reason was because I never wanted to do it. And then I said, okay, let me do it. I don't want to put in 2 years.
So a lot of reasons like played part in that.
Yeah.
And eventually, like, I think every decision you took after BPT, I mean, a lot of people are involved.
Yeah.
Because even when, like you said, when you were planning to do in Nottingham, you had your classmate who had done that before. So that played an important part. Then when you chose to do masters, probably your mother, your ex-boss, a lot of factors came into it.
Yeah.
That's great.
So she really motivated me to do it, which made sense, and I'm so happy I took that call.
Okay.
It's great.
But then after doing MSc, what do you think? I mean, people should come back to India and work, or is it much better because they know the system now in abroad? So should they stay back, or I mean, I understand it boils down to personal preference again, and a lot of factors again do come in. But then solely looking at what you've learned, it's better to apply it there or come back to India. And can you apply it back in India? Because we have something like manual therapy and therapy with machines, which we'll talk about in a few seconds. So I mean, did you learn that which you can apply here, or I mean, it's much better to stay back there and practice what you've learned there?
So as you said, it's a very, very personal decision, but professionally, of what I have seen, I think it has two sides to it.
Okay.
When you're over there, I think this is, again, there's no offense to anyone. Okay,
yeah.
This is just my personal experience and my personal view. I feel like when you're abroad, I think physio as a profession is valued a lot more than in India, of what I have seen in the past 3 years, 4 years. This is, again, I could be wrong, but of what I have seen, there's a lot more growth there. Okay, not
in terms
just
of
professionally.
Okay.
There's a lot more growth.
Okay.
Because things are more like research-based, evidence-based. Again, it has started to be here as well. I've seen so many of my batchmates and people who are my seniors also who've been doing a lot of research, and it's also they have also grown a lot of what they were, which is great again.
Yeah.
But over there, I think it just happens. Growth. I mean, there's a lot of I don't know how to put this. Like, growth is inevitable. Like, it's going to happen.
Okay.
Professionally is what I mean. Unless, like, obviously you're holding yourself back and you're not interested.
So the system is like that. Ki once you get into the system, you're bound to achieve success professionally.
Yeah, is what I think.
The system just pushes you towards success.
Yeah.
Whereas here, you create a system or you fall back into the system here, and
you have to. I think here you have to try a lot harder.
Okay.
To get it. It's not that people there don't work hard. Of course they do. But it's just the system, like how things work there, how the profession is valued a lot more.
So when you talk about the system, it's the system being placed in the hospitals and organizations where, like every patient, whoever needs a physiotherapist, gets, I mean, he or she comes to you, rather than here people have an option key whether they should go or they should not.
There also they have an option.
Okay.
But I mean, the whole healthcare system is very different there. They have their national health service where it's kind of free, right? Like they have services available for them. Here again, it's at your own expense. People have to go for physios on their own expense. So it really differs, but also depends on their mindset and how aware people are about what a physio does.
Okay.
Like in India, I feel like not everyone knows. Like till now, I have to explain to a person what I do.
It's like कि वो exercise कराता है.
Yeah.
या तो पोस्ट सर्जरी के बाद या आपको एक्सीडेंट हो गया है तो लाइक फिजियो के पास जाओ, आपको एक्सरसाइज बताएगा. दैट्स इट.
The other thing is, I think a lot of people also think that we only give massages.
Okay, that's weird.
So like people say, oh, you do give massages, right? And I'm like, no, that's not the only thing. It's very different, and people don't really know what a physio actually does. So you can't blame them for maybe not valuing or not going to a physio, because they're not many people are aware of how it's going to help them in their
Fair
life
enough.
or personally. So that way it's very different.
Like people already know what a physio is, so you don't have to convince them or like make them aware of what a physio does. They already know what it is, and then
So
Here
that's
you
the whole
first
thing.
have to explain your profession. You know?
Yeah, I have to explain to them, okay, what... See,
And-
again over there also we have to explain of what we are going to do.
Okay.
But a general idea of, okay, have your injury, you go to a physio, they kind of have an idea of what it is. Here I would say, again, I'm not saying no one has, but there is like a vast majority of people who don't really know what a physio is and what a
Okay.
physio does. So,
Okay.
of what I've come across.
So like coming back to that earlier topic about manual therapy and therapy with machines,
Yeah.
like doing physio with machines, and I mean, how is that different, or is it the same thing but just with machines, or there are more layers to it?
Okay, so this is a very complex topic.
Yeah, it has to be very brief and so that people can understand and they get an idea as to what it is. Like
Okay.
one major difference. That's it.
Okay, so manual therapy is basically what we do with our own hands.
Okay.
Okay, so like for example, like a massage.
Okay.
Like a soft tissue release would be manual therapy.
Okay.
Whereas a machine is, and a machine, like you put like, it's an external source. Yeah, you put in electrodes on your body, or there's something known as the ultrasound, which you do on the area that is injured.
Okay.
So that's like a machine.
Yeah.
How different it is? So the machine is used to relieve pain. Okay. Now there are certain number of sessions that you need to have for it to actually make a difference.
Okay.
Okay. Manual therapy is like an ongoing process. Okay, you do it.
So it has a start and an end with the machine. With
Yeah,
a
there are
manual.
certain number of sessions that you
Okay.
need to do.
Okay.
Again, see, I haven't really used machines as much in
What
my
about
life.
the place we're working in Mumbai before you? Were there machines there involved?
Not really.
Not
Like
really.
it was very, very rare that we used machines. It was
Okay.
more manual therapy.
Because I've seen there are clinics which only
Yeah.
market as physiotherapy with machines, like with automatic machines.
Yeah, I know. So the thing is now, when I was in DY Patil, we used to use a lot of machines. Most of our
Is
therapy,
it like in college?
in college,
Okay.
most of our therapy was machines.
Okay.
Along with a little manual therapy as well.
Okay.
But machines was used almost on all patients.
Okay.
Okay, now that's how I came out of college. Like I learned that and came out of college learning, okay, you use machines when you have injury along with manual therapy and exercises. But machines were a major part of the
Part of
treatment. Then when I came out of college and started working with active care, they trained me a lot in manual therapy.
Which was good, right? No.
Yeah, like obviously that we got results. So
I'm not
there
talking
were,
about your clinic. It's like, you learned with machines. So now you're getting a chance to work manually.
manual therapy. So I learned both sides.
Okay.
And I saw results with manual therapy. It's not that there were patients who didn't recover,
Okay.
So yeah, and I think it's a combination. I can't say that, manual therapy only works, because with manual therapy, there's also exercises you do as a part of the session, So it's hand in hand. It's like an adjunct to therapy.
Okay. Got it.
No one will ever tell you, you have to do this, take this machine, and that's it. That's going to make you better. No. It's always with something.
Okay.
It's like, I don't know, people use taping, people use dry needling, acupuncture. There's a lot of other treatment involved. And it's like 2-3 things put together that actually makes a difference. Okay, that helps. So yeah, I came out, I learned a lot of manual therapy, which was great. Like I did, that's what I learned and it helped people. That was great. Then when I went to the UK and I started working there after my master's, there was no use of machines whatsoever.
Okay.
Zero. Like the place that I was working for, they did not have any machines.
Okay.
Yeah. And although we did do a little manual therapy, that was up to me whether if I thought that the patient needed it, I did it. Otherwise, no.
Okay.
Now there are reasons why. So doing manual therapy is also very controversial because there is
Why is that?
there's a lot of evidence and research that people have done where they found out that manual therapy is not doesn't have a long lasting effect.
Okay.
Like for example, if I do manual therapy on someone, today, so that effect of what I have done to the patient of probably loosening the tissues or mobilizing the joint, that's not going to last for more than a few hours. So I do that today. It'll last for maybe a few hours.
But that can depend on the patient's response also, right?
Yeah. So that's the thing. They've done research which has found that it does not last for more than few hours.
Okay.
Okay, so that's why they say that manual therapy is not as
But there
helpful.
must be research where they say that manual does help more than few hours, right? Because
no, so that's the thing. So it's there's like mixed, evidence, and some
But
people.
personally, because you have treated both ways. I'm not telling you to pick one side, but having used manual therapy, you think it works, right?
I
Up to an extent.
According to me, it has a lot to do with how a patient feels or thinks how much the therapy is helping them. For example, now if a patient comes into me and tells me, I have a stiff neck, I think a massage will help. Okay, now if a patient comes in with the mindset saying that, okay, she's going to give me a massage, it's going to make me feel better. So I do it.
Okay.
I do it for them. If I feel like, okay, she has a tight neck, if I release it for her, even if it's giving her a relief of half a day, why not? At least it's giving her her pain comes down from a 6 to a 2, even for those few hours. So why not? So I give it to them.
Okay.
So I see, and then obviously you have to, it has to be given along with exercises that they do themselves. So it's very tricky because sometimes when you're doing a lot of manual therapy for patients, using a lot of machines on patients, they rely on that. They rely on it. They become very they rely on the therapy you're giving, on the passive therapy, and then they don't want to do any exercises on their own.
Okay.
So that is very, very tricky because that's not going to help them in the long run. You understand?
Yeah.
So you have to really
lot of
read the
factors
patient as
Yeah.
well. Yeah, there is a lot of factors. So I wouldn't say manual therapy is the best or machines are the best or exercise. It's everything. Like you have to really see.
Like it's funny because when you're in college, you are not exposed to a lot of new technology. Always given old technology to learn them, and then once you step out of college, like for example, in DY when I was doing dentistry, we had fairly new equipments to learn from. But then when we stepped out of college, there were times where we're like, why wasn't this taught in college? Because these are new technologies which are used in clinics. But funnily, what you are saying is you had machines in DY.
Yeah.
And then when you stepped out, you went, I can't say retrospect, like, you didn't go back technology wise, but then you went to manual because we learn generally in dentistry manual in college, and then once exactly, for us it was completely ulta. So I mean that's a good thing if that's happening in DY. That's a good thing.
Yeah, so that's how it has been.
And how was your experience in DY? Like if you could sum it up, like your 5 years in DY. So I mean
hectic.
Hectic because of the travel.
Traveling was one, but also like it was very don't know how to put it into words. It was tough.
Okay.
Yeah, it was tough, like studies wise, exams,
Okay.
A lot of studying, a lot of exams. Those vivas I still give me. Yeah, so it was everything because when I went to the UK and I saw how their teaching system is.
I was coming to that question. How was the education? Like, I mean, we'll focus on DY right now.
Yeah. So, it was tough. I would say it was tough. But obviously, I think it's tough for every field. There's a lot of stress, a lot of back-to-back exam. Yeah. There was lots. Okay. So, it was okay. Yeah. I mean, obviously, I came out as a physio, so it can't be that bad. Yeah, it was okay. It was all right.
And then, like, when you compare that to what you learned in UK, I mean, if you could, like, give one very... easy difference, like what you felt in while you were learning in DY and in Nottingham.
I think Nottingham was less stressful. Although people from the UK, like the locals, thought it was very stressful.
Okay.
But if you studied in India, I don't think that was stressful.
So that's a good thing.
That was fine. Yeah,
that's
was
a good
okay.
thing.
Obviously, their system was very different because there were a lot of assignments and all which we are not used to. Essays and very different.
A lot of research. I think
based.
Because that's one thing. I think we're not taught yet.
You're not taught as much. Yeah. So it was new. But yeah, once you learn it. Like any other thing, once you start doing it, you get used to it, then you're okay with it. But stress-wise, definitely.
So less working hours or less overall things you had to learn? Like
just less stressful when it comes to exams, and just how the interaction with teachers is more casual than, like how here we have to, like you're scared of teachers.
Yeah.
There you, nothing. Like you're not scared. It's very like a good, not good, but like very friendly relationship with teachers.
Because once they are not that strict and they still believe in you that you'll do good, automatically you also feel somewhere down the line that you should give your best because people are believing in you. Here people are like, after you, and then you start hating it after a point.
Yeah, it's just like even the vivas here, I'm sure everyone has been through it. It's very stressful.
But that's
I
one
think
thing.
That's how, I don't know.
If I've gone through the vivas in our medical field, you automatically become so thick-skinned that nothing affects you.
Yeah.
Like, people can come and roast you. You don't feel anything because you have been through vivas in the medical field, and that's something else. So
you
that's
know yourself, right?
Yeah. So you automatically become so thick-skinned that nothing affects you anymore. So as a physiotherapist, what are you tired of listening from people? Like there are times where people, you must have heard few things repeatedly spoken to you by people, and you're tired of it. Like,
This one.
Which one?
Massages. That's all I've heard. When someone hears that, oh, I'm a physio. Oh, so you give massages.
Achha.
And I was like, no, I don't give massages. But that's one thing I've heard everywhere.
Okay.
Exercises, I've heard from some people where people say, oh, you just make them do exercises.
Okay. And does that piss you off? Like, does that bother you that much? Or
the
it used
massages used to bother me, but not anymore.
Not anymore.
It's just that obviously then it comes down to they are not aware. They don't know.
It's like devaluing your profession because they don't, they say it so casually that they don't understand what you have been through to
get there.
Yeah.
But again, then I just put it down to they just don't have enough knowledge of what the profession is. As simple as that. So it's okay. It doesn't bother me as much. When I thought it through, I'm like, okay, they don't know. So then you just explain it to them. As simple as that. So it's fine.
Okay, so like coming to sports medicine, like have you thought about, since you have been in India for a few months now, have you thought about collaborating with sports associations or clubs, or like because I don't think there are many MSc in sports and exercise like in India, and someone of your caliber could help out. So like, have you thought about like collaborating with them?
So after I did my masters abroad, and then I started working. So I started working in a normal musculoskeletal outpatient setup. Okay. So I worked there for a year and a half, and I realized that I like it.
You like it?
Yeah,
okay.
I like it. So I don't know whether I want to go on field and work as a physio on field, because I think I love doing this outpatient job, which I have been doing.
Fair enough.
Although I don't have much experience on field, so I don't really know how much I will like it, except for those postings in University of Nottingham.
Okay.
Those are short postings where we had a lot of like help, I was not put on field by myself. So I don't know how much I like that work, but I know for a fact that what I have done and what I want to do, I love that.
Like,
so
fair
I don't
enough,
know if
like,
I want to go in that direction.
Yeah, but fair enough, because once you have gone through it, then only you realize you like it or not. It's not that you are saying you don't want to go on field without going on field.
Yeah.
You have been on field, you have been off the field, and you prefer off field.
I prefer off field.
That's completely fine, I think, Vasa.
Yeah, so I don't think I want to get in that direction only.
Okay.
I'm happy to do like just indoor work.
And like what was your daily schedule like? For example, after you did bachelor's, when you're working in Mumbai, what was your daily schedule like in India? And then once you did your masters and when you started a job in UK,
Yeah.
I mean,
How is it different?
Yeah, basically your daily schedule, like, yeah.
So in India, it was pretty much just doing my work, coming back home, and then having everything ready for me, because my mother's in the house.
Okay.
And we have everything on our plate.
Yeah, true,
like
true.
every other
Absolutely
household.
true, absolutely true.
Because we have helpers, we have mom, people around us. But obviously abroad, because I was by myself, there was a lot more happening than just work.
Okay.
So daily schedule was work. In the week it was fine because you go to work, come back, whatever, lunch, dinner, and you sleep. But over the weekends, I had to prep for the week. So lunch, doing the lunch and the laundry, all the personal stuff had to be done over the weekend for my week to go smooth. So that was the only difference. It was a big one, but that was the only difference.
Yeah, and that's a major one, because if you're not used to it, it's.
Yeah.
I mean, I personally know a few friends who could not adjust to that lifestyle.
Yeah.
And they came back to India. I mean, they left their studies midway and they came back because they could not adjust, and that's completely fine.
Yeah, it's completely fine. It's to each
because
his own, actually.
It starts taking toll on your mental health.
Yeah.
And it's much better in today's time to take care of your mental health than anything else, you know.
Yeah. I actually kind of liked that. I liked doing
being on
things,
your own,
being on my own and
the
doing my own
independence
things,
and everything. Because I think it added a new dimension, or like, you know, it could show your potential to yourself that you like earlier if you thought you could not do that, and now when you were put in that position or the situation, you managed to do it. So then you know, psychologically you think, oh, I can do that now, you know.
I think everyone can do everything. Until you're put in that position, you just don't know whether you can do it or not.
Yeah.
So it was great. I think I loved doing things by myself. Obviously, there are times where things get onto you, like because you're human. It gets onto you here also.
Mm-hmm.
But I completely enjoyed my experience.
Okay.
Of what I had.
Okay. And like what do you think, like, you know, how was your experience in like UK? Because once you came back from, I mean, you stayed there for almost 2 years, and I don't think you have got an accent yet. So, I mean, how did that work out? I mean, how did you manage to not have an accent when you came back?
I don't know. I think people who come back with an accent is because they want to come back with an accent. Because you can totally live in the UK and not have an accent. That's 200%. Some people just adapt to it, which I chose not to. I just didn't see why I should change my accent, because people did understand what I spoke.
Okay.
Even the locals, everyone understood my like accent and my language. So I didn't feel the need to change it. Yeah. I don't think anyone needs to, but maybe some people just
because people stay there for a week or a month and they come back with an accent.
Sometimes I feel there are people who I know who've changed their accent because they think that
accent will give them a job.
No. They think that other people, like the locals, won't understand them. But I think that's not the case, because I talk in my accent and they do understand me. So I'm not sure what the reason is why people come back with an accent. I think they just try to like adapt and fit in, which is fine. I just didn't think I needed it.
Okay.
I think
fair enough.
It was okay for me.
Yeah. Fair enough. Also, like when you did like your bachelor's, do you think there are things which you feel like, do you have any regrets? Like, you know, after doing bachelor's, you went for your master's. Do you think, like, you know, you have any regrets for that?
Not at all. I think everything fell in place. Things that I did not expect to. Things I had not even thought about doing.
Okay.
I did it, and I don't think I would change anything. It was perfect.
Okay. That's great. And like, I really want to talk to you about this. Like, do you think there are any breakthroughs in physiotherapy? Like, because what we know about is just the exercises. Or any new advancements in physiotherapy?
I don't know how new this advancement is, but there's something known as cognitive functional therapy.
Okay.
Which is basically how pain is perceived by people.
Okay.
So how pain is perceived and how it affects people.
Okay.
So everyone has a different perception of pain. Like, pain is not just an injury or tissue damage, you know. There's a lot of other aspects that lead to pain.
But that's something which, because I was reading your bio, and I came across this cognitive therapy, and I absolutely have no idea what cognitive therapy is, or what do you do in that?
So it's
and how do you
basically
explain to people like what cognitive therapy is?
So that's the thing. Like, it's not just about tissue damage or injury that leads to pain. There's a lot of how a person perceives it. Like sometimes people have stress, which can lead to a lot of pain. Sometimes they're depressed. A lot of mental, how a person is mentally as well, that has an impact on how they perceive pain. So it's a lot of therapy wise, there's a lot of communication, there's a lot of talking that you need to do and understand where the patient is coming from. What is causing their pain, when does it increase, when does it decrease, when it does increase, what are they doing, are they in too much stress physically, mentally, social life, everything. There's a lot of other things involved.
So it's a lot to do with psychological element combined with physiotherapy.
So that's how it is, where you have to really understand how the patient is perceiving the pain, rather than just like, I hit my elbow and I got pain kind of thing. So it's very tricky, but that's like this one thing I have learned, which probably has been there for a while.
You did a course in that, or you?
Yeah, I just did not a course. It
or
was
like
just
a program
a talk.
In that?
Yeah, it was a talk that was done for 2 days, where they had like a live patient and they had like a talk and they showed us how to go through the whole evaluation and everything. So it was very interesting, and I think everyone should do it. To all the physios out there, if you get a chance to do the cognitive function therapy.
And do you, I mean, whatever you have learned, it's useful to implement, right? To every patient, or there are...
No. This is more for chronic cases, like, low back pain in particular. So chronic low back pain.
Is it age related, or it can be for anyone?
It's for anyone. Anyone. It can be for a 20-year-old boy who's been having pain for 5 years, has tried all the possible treatments, no effect. Try cognitive function therapy, see what's going on. Other than,
as a patient, for example, if I'm a patient, how do I know that this doctor or this physiotherapist or anyone knows cognitive? I mean,
so patient is not going to know. That's what I'm saying. All the physios out there.
It's on you, basically.
It's on
physios to...
how to get things out of the patient, how to understand the patient's pain, because the patient is not going to be like, I have stress, that's why I have pain. They have no idea.
Basically, it just adds another layer to your existing treatment plan.
Yes.
Like,
Yes.
And, fair enough. Good. I mean, that's something which I was inquisitive to know about, because it's a new concept and I have not heard about it ever.
Yeah. So I think people should have a read. There's lots of papers there.
So, it is primarily for physios, or it can be for other healthcare workers also? I mean, when you did the program, there were only physios in that?
I think there were only physios.
Because that's something which... Because the concept behind it, I think it can be helpful for other branches
as well. But then it comes down to how they have ruled out any actual injury that has happened. For them to think that, if this is not an actual injury, they've tried everything. Have they tried whatever? People have tried manual therapy, have tried injections, steroid injections also people take. Whatever, everything is tried. Acupuncture, but there's literally painkillers, no effect.
Good.
Let's try cognitive. Let's see how
because I think it can be useful for other people also.
Yeah, I mean, the more the better, right?
Yeah.
Like, it's just going to help the patient.
So in physio, I mean, there are a lot of equipments, and this is my personal favorite question, like, which I want to ask you is, what's like a favorite instrument in physiotherapy? Like, it can be anything which you use often, or it can be a one-off instrument, but there's something about it which makes it your favorite in your field, that you love to use it whenever possible.
So with my patients, I generally work with a lot of exercise therapy. Like, I want the patient to do things on their own so that they don't rely on other things. So I rarely do manual therapy. I don't use machines. So it's more like understanding the patient and trying to get them to do exercises themselves. So for me personally, I love the TheraBand, the resistance bands that you get. So that's used a lot in therapy as well to improve strength, endurance. So that's I use it myself too. Like, I don't have any injury, but just as a strength
conditioning
equipment.
No.
Not strength, it's more endurance, but I use it in my exercise and workouts as well.
Okay.
So I personally love that. I think it's amazing. It has different resistance from low to high. So you can obviously change according to your capacity.
Wow.
So I personally like it.
Okay. So as a physiotherapist, when do you feel satisfied? Like, because in your field, you come across patients who have been told they cannot walk.
Yeah.
And, whenever they come to you, they mostly be coming with a negative mindset.
Yeah.
So how do you change the perception? And because you have to first, change the patient's psyche.
Yeah.
Like you have to do positive reinforcement. Change, make the person feel that no, with this physiotherapy, you will be able to walk again.
Yeah.
You will be able to use that limb again.
Yeah.
So what motivates you? Any success stories you want to share with that? What motivates you as a physiotherapist?
So for me, I generally think that when it comes to patients, I first ask them what they want to get back to. Like for example,
Okay.
if someone has pain in the foot, I want to know whether they want to get back to running or they don't run and they are just okay with just want to get back to their daily activities. That's just simple walking.
Okay.
So it's knowing what the patient's goals are.
Okay.
Okay. And then obviously setting time periods. Okay, by this time maybe we should get in, maybe you should be able to start walking a kilometer. Okay, then maybe a time frame of 2-3 more weeks and you should be able to start maybe climbing stairs. So even those small goals are very satisfying. So I will never tell a patient who has a knee injury, okay, you are going to be able to start sprinting and you're going to reach the Olympics. It's never like that. It has to be stepwise. So okay, you can tell them that, okay, chalk it out. Okay, we are going to work on this for the first few weeks, next few weeks this. If things fall in place, that's how we know that, okay, we have to tell them it has to come from you as well.
Yeah.
We can give in a 200%, but if a patient is not compliant, nothing, back to square one.
So patient's participation in his own rehabilitation also is a major...
Very, very big role. If a patient is not compliant, you can break your head. Nothing's going to happen.
Yeah.
So it's very, very important that a patient is on board for your therapy to actually work. So it's very, very important.
Like any success stories, like any one which you have personally come across and you would love to share with us?
I actually had a recent one. I've been doing a couple of online sessions. And actually this one's the only one I remember. So there's a patient who had wrist finger pain, thumb pain, that one.
Okay.
So she did go to doctors and she never tried physio. She's one of a friend's mother actually.
Okay.
And I did virtual physio with her, that is online on WhatsApp. So it was basically there were do's and don'ts. Okay, you do this, don't do this. Try, see, come back to me, tell me how it feels. And in 6 to 7 sessions, she was 90% better.
Wow.
So I was quite surprised about her recovery because it's one of those conditions where it generally takes quite a while.
Okay.
I was quite happy to help her get back to, her.
That's amazing. And that too over virtual.
Only virtual.
Yeah.
I didn't know, obviously I couldn't physically examine her, nothing. So it was great. I kind of see, that's how it motivates you, right? To do better.
Yeah, because if you could do that, then you could do that. I mean, you can do other things also, other great things, Vesa.
So yeah, it was a good one.
Okay, that's great. So talking about your MSc in sports and exercise medicine. So what is why did you choose MSc in this? I'm sure you have, and I know you. So, do you want to share about your background in sports? And because I think that also played an important role in you chalking out your career in physiotherapy, and then doing MSc in this particular field.
Yeah, so I actually have been an athlete since I was 6 years old.
Okay.
I got into it by chance. One of my PT teachers just picked up on me and said, oh, you run well, you should start training. So we had this athletics coach in school.
Okay.
So there were mornings training sessions. So I just happened to join and then there was no looking back. I took it up like proper full time along with obviously school. So it was great. And then once I reached like the 11th, 12th standard, I had to pick a career. I then chose physiotherapy because I had been to physios and, you know, seen how they function. And I was really like interested, you know. I was like, okay, you know, this seems something that I could be in touch with, you know, with my sports as well if I was a physio. So that actually got me into physiotherapy.
Okay.
And then, yeah, I've just always been into sports and fitness because I was an athlete. So that has actually helped me through my career as well, you know. Once you know a lot about physiotherapy, then, you know, you think back and say, oh, you know, I had this injury and, you know, that's how I did this and got better. And so, yeah, that was exactly why I actually took up physio.
That's good. Like, because I personally believe that whatever you go through in your, like, you know, in early years, it also, like, you know, dictates where you'll end up at, you know. So, like, I think while you were running, you may have injuries and then...
Exactly, that's what happened. And I had to go to physios myself. So that was one of the reasons I thought maybe if I am a physio, I'll be in touch with, you know, my sports side by side or, you know, something related to sports. So yeah, that's how I got into it.
Okay. And so, like, what's the best thing about being a physiotherapist? Like, because now you have been, I think, in this field for almost the last 7-8 years now or more.
Including my studies,
yeah. So, like, okay. Like, you know, what do you think is the best thing?
The best thing about it, according to me, is you can apply all your knowledge to yourself. So that's like been the best thing.
Okay.
Like injury wise, anything happens, you know exactly what to do. And then obviously helping people, which should be your biggest, you know, motive to help people lead a better life, improve their quality of life. So that's like a big one. Yeah, that's it. That's been like my main thing about being a physio.
So as a physiotherapist, do you think this profession is rewarding you enough? Like, because you have chosen it now, so
rewarding me in the sense I feel very satisfied. You know, end of the day when I know that, oh, you know, I've seen 20 patients and even if 15 or even if 10 of them have felt better, even 5, you know, improve their quality of life, reduce their pain in some way, still rewarding. Why not? I've helped someone in some way or the other.
Okay.
So according to me, yeah, it does. It is rewarding. I don't know. Just like because you are in this field to help people, and even if you're helping one single soul, why not?
And like, how do you plan? Like, because you have done your MSc now, how do you plan to keep yourself updated in this field? Because, like, what's more out there as a physiotherapist? Like,
updated, you can do a lot. There are a lot of research papers which you can go through. There are a lot of seminars, there are conferences. There are so many things online that can help you keep yourself updated. But what I do personally, I like to listen to podcasts, which we are doing right now.
Okay.
Because we don't have to read and I don't like reading at all.
Okay.
So I'm a better listener. So I listen to a lot of physio related podcasts, which help me keep, you know, up to date with things. Besides that, I also go for conferences once in a while, which which I feel will be beneficial for me. That's it, really.
Like, so, like, do you have any particular physio podcast which you would want to suggest, or it's just some random podcast which you come across and then, or is it some of your favorite physiotherapists who already have podcast?
No, so there is this one website, is it called a website or whatever it's called, Clinical Edge, who I follow a lot. So there are multiple, they have many speakers that come and like quite popular ones which are good in their, you know, expertise. So I follow only that actually. That's the only channel I follow for podcast.
Okay.
Maybe I should widen my sources, but I'm very comfortable with those. So I just stick with them, the Clinical Edge. So yeah, if people who have not do not know about it, you can have.
So as a platform, like podcasts and audiobooks do help.
For sure. I know so many of my friends who listen to podcasts. So yeah, for 100%.
Okay. That's great because it's a very new platform, and it's I think very it's like going back to the old radio days where you used to you used to work out or used to do something,
Yeah.
you're doing something and you're listening to radio. So it's something similar, like you're doing some like personally, when I'm driving back to far off places for my can be my hometown, or
Yeah.
you're driving to Pune, so instead of listening to music or songs
Yeah.
from your phone, I listen to podcasts from my favorite tech reviewers, and it can be just two people talking about headphones
Yeah.
for say like 2 hours. And if someone would have told me that you just hear two people talking about certain things, I would call them crazy. And then the funny part is now I'm listening to such podcasts where I'm listening to two people talking about one single thing
For 2 hours.
For 2 hours.
Yeah.
And I'm getting a lot of things out from
Out
there.
of it, yeah.
It's quite productive also.
Yeah, exactly. Even when I'm probably just sitting or walking, going for a walk, going for a run, I put on a podcast and listen to podcast instead of listening to music. And then even if you get like 20% information from it, why not? Like you're also being productive both ways. So yeah, that's how I also do.
Okay.
And function.
And like shifting to a new topic, like do you think is religion an important part of your daily life? Do you consider yourself a religious person, or it's something which is does it play an important part in your life?
Yeah, I don't think I'm very religious.
Okay.
But I am moderately religious.
I don't think I don't think you can call yourself very religious or too. It's just being religious, you having faith in a thing
I
and
do
just
have, I
doing
do
the
have
best of
faith.
your abilities.
That's the thing. I know there is God, and I do have faith, and I believe in God, and I do. And I think it does, according to me, it does play a role in my day-to-day life because I
Okay.
pray every day.
Okay.
And obviously, some things that happen in life have made my belief stronger.
Okay.
Has played an impact on my personal life, professional life, everything. So things have worked out, some haven't, and just I think all in all, I do believe, and it gives me a gives me a sense of peace and calm, just to know that
True.
there is.
And does it help you in your profession? It's a very different thing, but does religion play an important part in your physiotherapy?
I don't
for you?
know. I don't.
Because for example, it can be you do your best ability to treat an athlete or a patient, and then sometimes you pray
Yeah.
because that some things can go wrong.
Yeah.
But it can be something which does
Maybe. I don't know. I've never really thought about
about
it.
it.
But yeah, overall, I just overall pray. So I don't know if that helps or not. But yeah, maybe. I don't know.
That's good. Okay, so there has been a controversy where it has been, the controversy is it comes up from time to time where physiotherapists, can they use doctor as a prefix before their name?
Yeah.
And there's a widespread controversy, I think, even in physiotherapists also, whether they should put or not. So what's your take on it?
Honestly, I don't care.
Okay.
You call me a doctor, don't call me a doctor.
It does not
because
matter.
I'm literally here to do my job, which I'm doing.
Okay.
So I don't have this thing that, I should be called a doctor or I shouldn't be called a doctor. I seen in India, we are now, I think they have passed
A law?
case. Yeah, there was a case and controversy. So they have agreed that physios can be called doctors
Okay.
in India. But
Okay.
anywhere abroad, you're not called a
They're
doctor.
not called doctors.
Yeah, just healthcare
And they're okay with
professional.
that, I think.
Yeah, they're okay with that. So, but even when I had not gone to the UK and I was here, I was still okay with it. So I don't know.
I'm still not sure about this, but I know there are countries in Europe where even dentists don't use doctors.
Yeah. They're not called doctors. They're called dentists.
Yeah.
Yeah,
So,
yeah.
the doctor thing, I can't call it India specific because other doctors, physiotherapists, dentists do use doctors in other countries. So, But I think it's like to do with India and the people, like, you're in healthcare, you're a doctor.
Yeah.
And for the people, and for people like us who are into healthcare, we also believe that we are doctors. So, I mean,
But according to me, again, see, because personally I don't care, but if you ask me, in our curriculum, okay, like in physiotherapy, we study literally all the subjects that an MBBS studies, but obviously not 100%, maybe
a diluted version of it. Yeah.
Like
what concerns you?
Yeah. So if we are studying like from pediatrics to medicine to everything, psychiatry, everything is studied in physiotherapy. So people who think that, we should be called doctors, I don't think it's wrong.
Yeah.
I mean, obviously we've also worked to get, to what we are today and all of that. So it's not, I don't think anyone is wrong here. It's just how you feel about it. And I don't think being called a doctor is like a one-up for me or anything. So I'm okay not being called a doctor as long as my motive is one where, you're helping a patient get him back to what?
Normalcy, yeah.
Normalcy, that's it.
So
Doesn't matter.
Since the day you started physiotherapy, like your day one in college in DY, that is 2011? 12.
Yeah.
To now, from 2012 to 2021, have you seen a major change or any change at all in physiotherapy? How you treat patients or how it's being taught, or just the overall outlook towards physiotherapy? Has it changed in the last 8 years? Do you feel any change, or no, it's still the same?
I think I have seen a change.
Okay.
This probably people must have seen way before. But for me, what I have seen from DY to now is even my seniors and friends and people who I know who are physios, from what used to be just textbook knowledge has now become research, evidence, that sort of thing. So there's been like a switch. It's not just, okay, the textbook says this is good for this. Now it's like, okay, has there been any research done on the particular topic to tell us that, okay, is this A better than B or B is better than A, or there's no difference between the two? Yeah.
So what research? Okay.
Yeah. So it's just first, even us, like we've been taught just textbook, theory, textbook. What textbook says is absolutely right. Now we question it, a lot more, that, okay, why is that like that? Or talking about myself more.
Yeah.
Why is this better than this? Why, you apply it, you see what works for the patient, because every patient is different. You can't say this one thing is going to help one patient or this one thing is going to help one condition.
Yeah.
So that has been the major change that I have seen professionally by myself.
So what research was being done is being clinically implemented now.
Yes, a lot more. And there's a lot of more curiosity as
and
well.
Awareness also.
Awareness, amongst physios themselves. So yeah, it's been good. It's been a good journey. And I'm sure and there's no end to studying, There's so much coming, so much going on that it's just...
True, I mean...
You just learn. There's too much to learn.
It's like a never-ending process.
Never-ending process.
Okay. And coming off this COVID situation and the whole lockdown situation in India itself, how do you manage, how did you manage, or how do you still manage to keep yourself sane, mentally okay, just to be in this situation where, you're looking for jobs, you're looking for things to learn, or whatever you've learned, you can't implement it. You're getting time off, you have done all the major possible hobbies.
Yeah.
And so now how do you manage to keep yourself motivated to go back to the work whenever things open up?
I think for me the major one has been just exercise.
Okay.
To keep myself sane. That is one. So just working out every day. That's my thing.
Okay.
Other than that, I think a very big one now for me has been just being grateful.
Okay, that's
because obviously maybe we don't have everything that we want because of COVID, but if you think about people who have been affected 100 times more than you, you feel okay, you're so blessed to have what you have.
Yeah.
So just gratitude more than anything.
Just being alive.
Just being,
because you're getting another chance to
being with your family, everything. There are people out there who not with their family, don't have food to eat.
Gratitude and being grateful were just terms which we used to hear in movies or books, and now because of this, you actually like
what it is and how important it is. So
I think it's made you more humble also. Like life is so fickle, like anything can go wrong anytime. Like you can't take it for granted, and if you're alive you need to make the most of it, and I think just give it back to society in whatever way possible.
Exactly. So that's the only thing. Okay,
so exercise, and like have you been listening to any new songs, or like what's your favorite genre of music, like which you think you can, I mean you're still listening to it?
I am actually not a big music person.
Okay.
I only listen to music when probably someone's playing it.
Okay.
In the car, on a journey.
Okay.
Other than that, not really.
Even when you're working out or something?
I generally just put on a show to watch.
Okay.
Something going on in the background, but I don't care what the song is. It's just some music. One thing I just don't like is just music. I need some lyrics. What is that called? Where there's only music and there's
instrumental.
No lyrics. Yeah, I don't like all that. And I don't like very fast rock kind of music. So besides that, I'm okay with anything.
Are you into like Bollywood music or like?
No, not okay. Both. Nothing like one over the other. Nothing like that.
Okay.
But I'm not big on music in general. So I don't think I can give you much information.
I'm sure you must be like, because of the time we have, you must be watching a lot of shows. Like, so what has been like, for example, in the last 1 year?
Yeah.
What's like your favorite show? Like it can be an old show, it can be a new show, it can be anything.
Yeah, I really like mystery. Thrillers.
Yeah,
genre, right?
But what was the show which...
Mine, the favorite one?
You can name more than one.
There's this one show called The Spy.
The Spy.
Yeah.
It comes on?
Netflix.
Okay.
So
it's about
these Israel and... So basically a spy from Israel goes into some other country.
Okay.
And he becomes a defense minister of that country, and how he gives them information about what's going on by reaching that level. He becomes the defense minister of another country.
So he's a spy
from Israel that goes into, I don't remember which country, Syria. Yes, and he becomes the defense minister of Syria.
And he passes on the information.
Yeah, but he gets caught. And it's a true story, actually. And he gets caught. Yeah, it's a really, really good one.
Okay.
So yeah, I'm a lot... I like comedy as well. So Friends, all-time favorite.
So
all-time favorite.
Is Friends... Are you rewatching it? Or
Keep watching. Friends
No, are you rewatching it now? Or I mean, had you watched it before?
Which one?
Friends.
Yeah. I've watched before. I keep watching it.
So
whenever I want to, yeah.
Okay.
It's just on.
It's an all-time favorite for most of the people.
Yeah.
That's great.
So yeah, but... mystery.
And so for podcasts, or any songs, what's your favorite platform? Like Spotify, Apple Music, or you have Amazon Music? Like, where do you listen to your podcast for?
I actually have this. Can I open my phone?
Sure.
It's called SoundCloud or something.
SoundCloud, yeah. SoundCloud.
So Clinical Edge plays on SoundCloud. That's how I know. That's how I am on SoundCloud. Otherwise, I don't know any other app.
Okay, so you're on SoundCloud for Clinical Edge.
Yes, just for that.
Okay, that's great.
So not any other.
And like speaking about a phone, you're still using the OnePlus 6 or 60?
Yes. No, 6.
6.
3 years back, I got it.
Okay.
Look at it. So
are you happy with the phone now?
I'm very happy. It's not, touch wood, as of now it hasn't given me any problem in 3 years.
Okay, 3 years.
3 years, and it looks pretty good.
I'm sure they have released the 60, the 7. The
70 is also coming.
The 9.
8 also. Yeah, exactly.
Yeah, it's been 3 years.
Every 6 months they have a new one. So yeah, I've been good with my phone. Now let's see.
So like, what's the most used thing in your phone? Like the camera? WhatsApp.
Yeah, I'm not a phone person.
Yeah.
As much. Only the basic things I use. So yeah, maybe social media, camera. Camera is really good.
Okay.
Yeah, I'm sure you know. OnePlus has a good camera. But other than that, yeah, it's a normal phone for me. I don't use too many features. I'm sure there's a lot more, but I don't use it because I don't know.
And like, one thing which a lot of people now are doing is like homes are not meant for work. Okay. Like the work from home culture has been very new for Indians right now because of the lockdown. And people are working from home more than ever, especially in a country like ours. And confined to their, houses. So they have been working, and I think majority, are using wrong postures while working from like, using the laptops. So any particular suggestions you would want to give those people, or what exercises they could do, or I'm sure like you can't show that here right now, but any tips for people who are working from home, they can do it to like, maintain their posture, not get into bad habits which might, screw up their spine or anything, muscles late in life.
I think just like rather than sitting on a bed, just like having like just a simple table and chair would make a difference.
Like sitting and...
Yeah, rather than how you sit whenever you're sitting on a bed,
Okay.
you don't have back support as much. So you tend to like sleep and slouch and all over the place. When you have a table and chair, even if you're slouched, you still have backrest. So that's like the most basic thing someone should do. Other than that, more than anything, more than affecting their posture, I think they need to be more mobile.
Okay.
Take shorter breaks, frequent breaks rather, even if it's like a 5 minutes, just walking around the house, going to the toilet. So just avoiding long hours of constant sitting will make a lot of difference. Yeah, just to their overall health.
And are there any equipments which people can buy and use at home to improve their posture while working? Or, I mean, do you suggest that, or you think they should first visit a physio and then buy such things?
Yeah, these things I don't think anyone should just go and buy by themselves.
Okay.
Because 90% of the people don't need it. 95 rather.
Okay.
So you always, whenever you're buying something related to your health, I think it's very important to consult a specialist so that you get an insight of, what do you actually need it, or you're just doing it. Because what's the point if you don't need it and you're doing it and you're causing more harm than good? So always...
It's just the marketing, like, companies are out there to, make sure that you feel that there's something wrong with it. But there are times where there's nothing wrong with it.
Yeah, exactly. So I wouldn't suggest anyone to buy anything unless you consult someone who's there to help.
Okay, that's great. So like coming to the end of it, like what do you want to tell people who are just about to join physiotherapy or thinking of becoming a physiotherapist? Do you think there's a scope? Do you think for the foreseeable future they can do BPD and
I think
there's a scope for that
yes,
in India?
Definitely there's a lot of scope. Like even in India, people are becoming more aware about how physiotherapy helps post-surgery, post-injury, just in life. So I think there is a lot of scope, and people are getting more progressive. So if you think you want to do it and it's your interest, go for it. Just go for it. And it's not that you have to study abroad, to progress or become like a big physio and, progress in your field. It's not like that. You can also become a great physio by living in India, okay? So this whole concept of, to progress and grow in my field, I have to go abroad, not a thing. You can do it in India as well. It's just that you should have that thing in you to progress, So if you want to, go for it. Everyone, whoever wants to do physiotherapy, it's a great field to learn, grow, everything.
That's great. So like, what's next for Mansha Thakur? Like, where do you think you'll be, going in things will change due to many reasons, but then according to your plans, what's your plans for the future? Like for the next couple of years?
I actually want to do a lot of
clinical work. Do you want to start your own center? Do you want to go into education? Like, do you want to teach?
No.
Or do you want to work in a medical facility or work with sports teams? Like, what do you think?
I definitely don't want to teach because I don't think I can do that.
Okay.
But yeah, I want to work in maybe like a hospital or something.
Okay.
In a clinical setup, basically, not in a hospital. Yeah, so next couple of years, I want to do clinical work. Then maybe 10-15 years down the line, I'll maybe like wean off or like not do clinical work and do more like, I don't know, something
Start
else.
A center?
Yeah, maybe that, or I don't know. But
retire?
No,
Like-
not retire. But definitely for the next 10-15 years, I would like to do just clinical work and, see patients one-to-one. And
You love
as
that.
of now,
You love
yeah,
that.
I love that. For as of now, that's
But
my,
like, do you want to plan your start your own practice, or do you think
No.
it's too hectic and you just rather
not anytime soon. I want to just work, I don't know, for someone, under someone, all that, just now. And then see how it goes. I don't have any
but not
fixed
get
thing in
attached
mind.
to like any clubs or any
No, not. I don't think I
associations?
want that. I just feel like I
because I'm sure
enjoy
there
this
must
more.
be off the field jobs also there, like even in, like, and I don't know, but like if you plan to go back to UK, I'm sure that like you have so many football clubs, you have so many rugby clubs, and
Yeah, I know, but I just feel like
Okay.
I'm better indoors. Like I prefer that work than being on field and waiting for an injury. I don't. I just
Fair
don't.
enough, fair
yeah,
enough.
I just no. I like to see patients like back to back, and I like that pace of work rather than
like you learn
yeah. You
new,
see a lot more patients, and I don't know. For me, I just feel like I like that pace. It's more fast paced, and I like that work more than going on field for a match. Or obviously, it's not just the match. There's
Yeah.
a lot of other off field work also you have to do with the team. With respect to the team, their health, and or whatever everything that goes with it. But I prefer this sort of work, clinical work.
That's great. And for people who are watching this and who would want to connect with you or just want to talk to you more about certain things, how can they connect with you? Like, if you could share your, I'll be linking down all your social media handles and your email in the description below. But still, because it will also go for an audio podcast, so people would want to know how to connect with you.
I'm very proactive when it comes to anything, actually, any social media also.
So like, what's
I
a social media
respond.
handle where they can connect with you for that?
So Instagram would probably be the best.
Yeah, it's-
Mansha Thakur. You would probably put it down there.
Yeah, so it's Mansha,
Mansha,
MAN
Thakur.
Mansha Thakur
2.
2.
Yeah.
Okay, the number
That's my
2.
Instagram. Yeah. Or then just email. Email also would be great.
Yeah, so,
That's
like, what's-
manshathakur94@gmail.com.
Okay, good enough. So anyone who wants to connect with you about physiotherapy, about
anytime.
MSc,
Anytime.
about potential collaborations with you, they could
Anytime. I'm always open to help people. Happy to help.
Yeah, and
Any
you're
aspect.
still very young. I mean, people don't realize that healthcare professionals, they start young. So by the time they're already 25, they have so much experience that they get fit anywhere. And yeah, that's good.
Yeah.
Anything you would want to say from your side about physiotherapy? Like, I mean, there might be some certain misconceptions, certain myths, or certain, I don't know, it can be anything which you would want to share from your side.
Misconceptions. Okay, so physios don't only make you do exercise.
Okay.
There's a lot that comes with it.
Okay.
A physio adds years to your life. As simple as that. Okay, so improve your quality of life, help you lead a better life. Yeah, pretty much it. That's it.
That's amazing, because, and especially like you're coming from that sports field and you're doing, I think it's a way of giving back to your sport also, where you came from, because and especially when, for example, when you were an athlete, you may not have physiotherapists who were like MSc in sports. So you would, now if an athlete goes through any particular condition, they know there are experts out there like you who can help them out, and especially the sport itself.
Yeah.
That's good. So thank you, Mansha. It's been an amazing talk with you. Hopefully we'll soon meet you again for a round 2 with you soon.
Okay.
In India, in UK, in Australia, in Canada, I don't know where.
Yeah.
In Germany,
Soon.
in Saudi, I don't know where. So inshallah we'll meet soon.
All right. Pleasure.
And thank you for taking out time to shoot this podcast. It's been a learning curve for me also. I mean, I got to learn few new things which I've just heard about it, but never in depth.
Yeah.
And yeah, let's
Okay,
see.
thank
Thank
you.
you so much. Thank you.